So, the answer to today's puzzle that was posed about the picture of the individual's foot that came into the clinic, we think is a sneaky little injury. So, what we think is going on is this injury is called a Lis Franc's injury. And what is a Lis Franc's injury? Well, here's your foot that's been adequately drawn on so we can try and explain it. So, these bones here, these are your metatarsals, okay, that join into your toes. And then we have your tarsal bones in your midfoot here, which are like blocks. So this is the bit basically between your your midfoot and your hindfoot. It's almost like the intermediate component, and it's quite a complex little area. So in between these little joints here, which are your tarsal bones, we have a complex ligament and capsule system. Now, usually your foot is quite a stable structure here. It's just basically formed because of the arch. So along this side, we've got an arch that would go that sort of direction, and then another arch coming through there like that, and that gives us quite a stable sort of situation. However, in here we need a degree of movement and we need a degree of stability, so the foot's divided into columns. So we've got a medial column here between your first or your medial cuneiform and your first ray, your second and third cuneiforms and your second and third metatarsals, and then you have your lateral column, which is between your cuboid and your fourth and fifth metatarsals. And these are actually three distinct sort of structures that we can see anatomically. Now, what happens in this kind of injury? It's not massively common, but when it does happen, it's often misdiagnosed and it can be missed. And what tends to happen is that the foot is plantar flex. It's almost like you go on your tips of your toes like that. So if that's my toes would bend, and we've got an inherent force pushing us forward. And then what will happen then is we will tear or we will injure part of the ligament system here. Now usually it's between your first and your second, or your second and your third. Now it's called a Lis Franc injury because we just take this as like a joint or like a ligament complex. Now Lis Franc was actually a surgeon in the Napoleonic Wars, and I'm probably going to bore my staff with this because I keep telling the story. He was the first one that sort of talked about them, and what would happen is riders on their horses would fall off and their foot would get tapped in the stirrup, it'd be forced back into plantar flexion, and it would disrupt this complex here. Now, he was pretty callous, and the way they used to treat them is they'd amputate. Luckily, we don't amputate anymore, but what we have to do is we have to work out what's going on. So, what kind of stages of these ligament injuries have we got? So, usually there's like three separate sort of variations. There's a grade 1, which you tend to find that people can weight bear, but they're very, very tender when we palpate over the ligament system or like the little joint system through here. On an x-ray, you'll see not a lot of movement there. There'll only be about maybe 2 millimeters of gapping when we go and check that out. So that's your grade 1. Stage 1s, and they're quite nice to treat, and they should respond favourably. Your stage 2, again, they'll be partially weight bearing, so they won't like walking on it too much, but they will be able to put some weight through it. They'll still be very tender through here. And the other thing is like when we go and do an x-ray, we'll see more gapping, between about 2 to maybe about 3.5 to 4 millimeters worth of gapping will come between the joint, indicating there's a degree of instability there. And then at the top end, there's a grade 3s, which are very, very tender. They will not be able to put any weight through the floor at all. And on an x-ray, we'll see anywhere over like a 5 millimeter gap of what's going on. So that tends to happen. So from that, your main mechanism of injury we just discussed is, unlike an ankle sprain where you tend to go down and in underneath like that, this just tends to go right in and right over the top. So what is it commonly seen in? Well, you'll often see it in contact sports, people that are maybe just about to push off and then they're caught from behind and forced into that plantar flexion. Skydivers, when they land, they'll go and get it, but this wasn't a skydiving injury, although we might just call it a skydiving injury. People who've got their foot planted on the floor and then suddenly fall forwards, that's another one that'll do that. And if you're unfortunately a horse rider in the Napoleonic Wars, then you are at risk. Our typical signs that we'll see: tenderness over these joints in here, quite a lot of swelling around the midfoot, the ankles tends to be okay, and the cardinal sign that we sort of got today was you will quite often find on the underneath of the foot a fair bit of bruising coming through here, and that was the little clue. So people often go, if you see the bruising there, we'll think we've got a rupture here, but actually that bruising there was indicating we had a problem there. So that's my tip. I reckon it's a Lis Franc's injury. We will soon find out by the end of the week. And we will have a look, and we'll even check out some of its rehab. So that's that. I hope you found that interesting, and we will talk to you later. Bye bye now.